Good morning, everyone. Welcome to our 2021 Elder Law Day virtual summer series. My name is Christy McKenzie. I'm the Assistant Coordinator of Neighborhood Services in the Department of Senior Services of Erie County. I would like to take a minute to thank those individuals who helped to make our summer series possible again this year, including our County Executive Mark Polencars, Karen Nicholson, the CEO for the Center for Elder Law and Justice, and our Senior Services Commissioner, David Shank. This presentation will be recorded and will be available on YouTube shortly. We also ask if you have any questions today to type them in our Q&A panel. Please refrain from including any personal information when entering in those questions. Please allow me to introduce our guest speaker, Kelly Sarama. Kelly is a supervising attorney at the Center for Elder Law and Justice in the Healthcare Advocacy Unit. She represents clients in appeals and grievances involving Medicaid, Medicaid managed long-term care, Medicare, and private health insurance companies. Kelly is a member of the New York State Bar Association, where she participates in the Health, Law, and Elder Law Special Needs Committee, on the board of directors for the Bar Association of Erie County, where she is the chair of the Elder Committee. Welcome, Kelly.
Thank you so much. Good morning, everyone. Thanks for joining us today. Today's presentation is going to be on 2021 Medicaid basics, some updates, and current. Including specific personal information if you have questions, but that said, the Center for Elder Law and Justice does provide free legal assistance, and I would be more than happy to take some calls and emails after this with some personalized questions. When it comes to Medicare and Medicaid budgeting, as we're going to talk about, it is really important to get a personalized evaluation of your circumstances. So today we're going to talk about a little bit about Medicare, because when I talk about Medicaid, I do think it's important to make sure that folks know the differences just generally from Medicare and Medicaid and how the two insurances work together. I'm also going to talk about how to get home care services and some very common issues that we run into in the legal aspect of things in this area. And I'm going to briefly talk about pooled trusts and how they might be able to help folks stay at home and get the home care services they need for a longer period of time. So Medicaid is generally limited to those with low income and minimal assets. The caveat to this is that it's also often for folks with high needs. So oftentimes people think that just because they may be above the income level for Medicaid, they can't access the benefit. But what is often unknown is that Medicaid is the primary payer of long-term care in this state and pretty much across the country. So that means that Medicaid provides access to benefits above and beyond what most insurances will cover for home care services and long-term care generally. Medicare is generally limited to those 65 and up unless you have specific diagnoses or Social Security disability for a minimum of 2 years. So if you are disabled and unable to work under age 65, you can access the Medicare benefit after you've been disabled and receiving Social Security disability income for a minimum of 2 years. If you qualify for both, you're considered dually eligible. So Medicare is in parts. Medicaid is typically considered in levels. So Medicare, there is Part A, which covers your hospital, Part B, which covers your typical essential services and your doctor's office visits. It does not cover vision, hearing, and dental. Medicare Advantage is just simply when private plans are reimbursed by the federal government to provide A plus B administered by a private plan. Sometimes they also do include Part D. So D is for drug. It's an easy way to remember that. Part D is your drug coverage. If you are in traditional, just getting straight A and B Medicare, you also need to get some drug coverage through a Part D plan. And like I said, the Medicare Advantage plans sometimes include drug coverage in their own. Sometimes you have to sign up for the separate benefit. There is also a special program called LIS, Low Income Subsidy, which helps Medicare Part D cost sharing, and it's also known as extra help. So you may be able to access extra help if you are low income and unable to pay for all of your prescriptions. The Medicare Savings Program is a Medicaid benefit that pays for Medicare costs. So this is often a little bit confusing, but that you do not have to have full Medicaid in order to access this Medicaid benefit that pays for Medicare costs. So you don't apply at the Social Security Administration where you apply for Medicare. You apply at your local Department of Social Services for this benefit. There are 3 different levels of the benefit. Qualified individual is the lowest level, and you actually cannot have that and Medicaid at the same time. You have to choose one or the other, and that's going to pay for your Medicare Part B premium. There is then the SLIMB, Specified Low Income Medicare Beneficiary. That's going to pay for your Part B premium. And there's QUINB, Qualified Medicare Beneficiary Program, which is going to pay the highest level of benefits here. It's going to also pay for some co-insurance and cost sharing that you would incur through Medicare Parts A and B. If you don't have enough work credits to qualify for premium-free Medicare Part A, it can also help with that. So Medicare savings programs do not have asset limits. They only have income limits. For some folks, you're going to want to think about the Medicare Savings Program, but not full Medicaid, specifically if they have excess assets. So for example, I once helped an individual get the QMB program using a pooled trust to divert excess income just to get QMB and not full Medicaid, because they had multiple real estate properties. They had a rental property that they weren't getting income from. They had some family living there, and they had a property that they lived in. So they were automatically going to be above the resource limits for Medicaid. But this individual had really high health needs. They were on several organ transplant lists, waiting lists, we're seeing specialists every other week. The costs were eating them alive, essentially. And so what we were able to figure out is, while they weren't going to qualify for Medicaid, we could get them to qualify for the QMB program. So you can't officially spend down to get a Medicare savings program. You don't get a spend down letter saying, this is your spend down. This is how much you make above this level. And here's how you get, here's how you take care of your spend down. But money that is diverted into a pooled trust for purposes of qualifying for Medicaid also is disregarded for the Medicare Savings Program. So you can, if you are a disabled individual, sign up for a pooled trust and divert your excess income and show that you are depositing income every month into your pooled trust to qualify for the Medicare Savings Program in addition to traditional Medicaid. And you can do it only for the Medicare Savings Program, which is something that I just like to highlight, because oftentimes folks don't realize that the pooled trust is actually available for this too, and not just straight Medicaid. Toward the end of the presentation too, I will touch on a little bit more on pooled trust. So I apologize if folks are unfamiliar at this phase with what that is. I will go into it a little bit more. So the resource and income limits for 2021. This is for community Medicaid, disabled, aged 65 plus, and blind applicants, recipients. The resources, if you are a single individual, are you can have up to $15,900. A married couple, can have $23,400. And for income this year, if you are a single individual, you can have $884. And if you're a couple, you can have $1,300. So, what does it mean if you are in excess income or resources? Well, I want to touch on spousal impoverishment protections first. Spousal impoverishment protections. So this comes into play when the spouse of a Medicaid applicant or recipient receiving long-term care services wants to be able to retain a higher level of the spousal income and resources. So this applies where there's only one spouse getting Medicaid services and the other spouse does not need Medicaid. Often, folks think it only applies in nursing home cases, but that is not true. This type of budgeting is also available for anyone receiving MLTC, Medicaid Managed Long-Term Care Services at home, and the waiver programs. So you can get spousal impoverishment protections, again, if you are living in the community getting long-term care or in a nursing home getting long-term care. And it allows the non-Medicaid spouse to retain $3,259.50 of the income. That's much higher than in the previous slide, around $1,300 of income. The resources that the community spouse, so community spouse is just the phrase that we give to the spouse who is not on Medicaid. That's why it's often confusing and not realized that someone also living in the community getting home care qualifies for this, and their spouse is still going to be called a community spouse. So I like to refer to them as the non-Medicaid spouse. The non-Medicaid spouse may have up to the greater of $74,820 in assets, or 1/2 of the couple's total combined assets, up to $130,380. And this allows the Medicaid recipient spouse to also then have that $15,000. I'm going to go back to the previous slide. Oh, 1 second. I want to reference these numbers exactly. So that also, allows the Medicaid recipient spouse to have the $15,900 in resources, in addition to these numbers that the community spouse can have. Just one other thing to note here is that the homestead, where the individuals are living if they own their home, is an exempt resource. If one spouse goes into a nursing home, but their community spouse, the non-Medicaid spouse, still resides in the home, it continues to be an exempt resource. So that does not count when you are considering these levels. So income spend down, what happens when you make above the income levels for Medicaid, but you still need the services? Well, when an individual or couple has excess income above the limit, you get assessed with what's called a spend down. The spend down is the amount of money that you have in excess of the Medicaid limits. So how you can manage that spend down in order to actually get Medicaid each month. You have to literally spend down, that's why it's called a spend down, to the Medicaid level in order to get the benefit. So you can submit unpaid medical bills equal to the excess income to the Department of Social Services each month. The caveat to this is that it can be pretty difficult for people to meet their spend down in this way, because you do have to have recurring expenses. You have to be able to show that it's estimated for at least 6 months you're going to have these recurring expenses in order to be able to meet your spend down in this way. You can pay the excess income directly to DSS or your Medicaid Managed Long-Term Care Plan, basically like a premium in order to qualify for the benefit. Or for disabled individuals only, if you are legally deemed disabled, you may divert your excess income into a supplemental needs trust or a pooled trust, which is a type of supplemental needs trust. Money put into the trust is exempt from Medicaid, so the spend down is reduced or eliminated. A married couple with only one Medicaid recipient may not use a pooled trust and spousal impoverishment budgeting together. They must choose one or the other. And this is, it's a little unclear where this comes from, but it's from case law. So if you just try to Google this rule, it can be confusing to figure out, which budgeting, if you can use both. The answer is that a married couple has to choose between the traditional budgeting and using a pooled trust if they have excess income to divert, or spousal impoverishment budgeting. So if you choose spousal impoverishment budgeting, and the community spouse, remember, can have over $3,000 in income, if you still have income above and you would still have a spend down, you cannot use a pooled trust to divert the excess above the spousal impoverishment level. You have to meet it with either unpaid medical bills or paying it directly to your plan or DSS. So if you have excess resources, and when I say resources, as I said, your house is exempt. So what I mean are basically liquid assets. So checking, savings accounts, cash out value of any kind of investments at the time, so stocks, bonds, things like that. Life insurance policies. So not if it's a term life insurance policy, meaning that you don't pay into it over time, there's nothing you can access during your lifetime, there's just a beneficiary upon death, then that's not something that would count towards your resource levels. But if it's the type of policy that you know has a premium, you've been paying into it, and it does have money you can access during your lifetime, you could choose to cash it out. The amount of money you can actually access to cash out is considered available to you for your resource level. So, you know, an average amount of a policy might be 10 grand that somebody has paid into. Actually cashing that out doesn't give you $10,000. It typically gives you, you know, $2,000, $3,000, somewhere in between there. So the money you can actually access is what counts towards your resource levels. Just something to note. So some recommended ways of spending down if you do have excess resources. You can use a trust, but that is cautioned, and I will talk about transfers of assets in a moment and why, depending on your age, if you're above 65, it can be a little risky. We would typically first recommend that you take a look at a pre-need funeral and burial agreements and funds. You can prepay for these things. You have to get an irrevocable trust set up for them, but essentially, if you have, let's say, 10 or 15,000 excess resources, you do not have your funeral arrangements taken care of, but you do need to get home care services in the imminent future. One way you can spend down to qualify is to go to a funeral home of your choosing and to sit down with them and set up a burial fund, a funeral fund, or both. So there you can get these for your funeral arrangements, and you can also set up that burial arrangements with a cemetery as well. So when I say funeral / burial, you know, there can be separate aspects. There's also agreements that can potentially lump them all together and pay for everything together. So you can go to the funeral home of your choosing and discuss that with them and tell them that you are interested in setting up an irrevocable burial fund or funeral fund. And you can set the money aside during your lifetime to prepay for everything. If you do that, it should be irrevocable. If it is a revocable fund, then the money is still going to be considered available to you. If it's irrevocable, just keep in mind, you don't want to put in more money than it would actually cost for the things that you want, because you can't access it once you deposit it. So irrevocable means that once you spend the money, you're not getting that money back. That's why, you know, once it's set aside, you have spent down successfully for Medicaid. And then purchases for fair market value. So that just simply means, you know, not gifting, but going to buy things. You are allowed to spend your money. If you have excess resources and you apply for Medicaid in August, for example, if you spend down, let's say you've got, you know, 10,000 extra dollars, and you want to go purchase a new vehicle or something like that, you can go make that purchase, and then in the following month, you will qualify for Medicaid. So it's not the next day, but as of September 1, if I'm applying now and I have excess resources, September 1, as long as I have that money spent in August on fair market value items, I can get the Medicaid services that I'm looking to get. Speaking of vehicles, just one more thing with resources, each individual can have one vehicle to their name. That includes married couples, so if you each have a vehicle, that's going to be considered an exempt asset. But if you have multiple vehicles, then the second car would start counting towards your resource levels. So, penalties for transfers of assets. Upon application for Medicaid coverage of long-term institutionalized care, any resources held by the applicant or a spouse at any time during the period 60 months prior to the application, known as the look-back period, must be accounted for in order for the applicant to become eligible for Medicaid. Receipts for large purchases, we recommend saving them, and should be made available if you have them at the time of your application. Any transfer of an asset for less than fair market value, essentially a fancy way of saying a gift, made within the look-back period will be presumed to have been made for the purpose of qualifying for Medicaid and will likely result in a period of ineligibility for Medicaid coverage for long-term care. So when you go into a nursing home and you apply for Medicaid to help you pay the cost of that care, because for anyone who may not be aware, the average monthly cost of a nursing home in this region of New York State alone is a little over $11,000 a month. And that's just the average cost. It varies. So what happens is that the Department of Social Services requests 60 months or 5 years worth of all of your resource and asset information to then look through it to see, and anything that is $2,000 or more in a single transaction or patterns, irregular patterns, are flagged. So what I mean by a pattern, it could be, let's say, $1,500 withdrawals every single month are happening. That's under $2,000, but if they notice it happening every single month for, let's say 7 months, they have the right to ask about that and to potentially flag that. What they're looking for is to see if you have gifted money, essentially. You are allowed to make purchases, as I said. So, oftentimes people might say, well, I withdrew or wrote a check for $10,000 because I got a new roof. Okay, great. What documentation do you have to prove that you got a new roof? And are you the owner of that home? If yes, then if you can, demonstrate who the check was made out to, fine, that will not be a problem. But if you wrote $10,000 and gifted it to your adult child, that's going to be a problem. And so what does that mean? What does that look like? Let's say you do gift a little over $11,000. Let's call it $11,000 to your adult child, and you're in a nursing home. What the local Department of Social Services must do then is presume, when they see that you have gifted money in order to qualify for Medicaid, and there's a math equation that they have to do. So they take the amount actually transferred, they divide it by the average monthly regional cost of a nursing home. The state sets that amount annually, and then they come up with a number. So let's say that our average regional cost was 11 grand for this year. It's a little more, but we'll use an even number for the example. And somebody gifts 11 grand. They divide that and they get the number 1. That is 1 month that you will not be able to use Medicaid to pay for the cost of your nursing home care as a penalty, as a transfer penalty, because you transferred funds for less than fair market value. Fancy way to say you gifted your money. You should have kept that money available for the cost of your care. And so because you did not, you will not get Medicaid to cover that 1 month of your care. That means you're going to rack up the private pay bill. You may or may not actually have the money to pay that. That's another topic of conversation. But that's what essentially happens. Now, this has never existed. This look-back period has never existed for community Medicaid before. However, it is about to. It won't be a 5-year look-back. It will be a 2.5-year or 30-month look-back period. Beginning October 1, 2020 was when this was supposed to or slated to begin. However, with the public health emergency, the state is not allowed to make access to public benefits more restrictive, so it cannot be implemented until the state of emergency is no longer in effect. I know in New York State it was recently lifted, but no guidance has been issued. There's nothing indicating that this is going to begin to be implemented yet. The last conversations I was privy to directly with the New York State Department of Health, they indicated that it's likely to be implemented in January 2022. So beginning October 1, 2020, there will be a 2.5-year look back or 30 months for community-based long-term care applications. This is not all community Medicaid. So if you just have straight Medicaid but not long-term care services, you don't need home care, you will not be exposed to this. But if you are applying for a Medicaid Advantage long-term care plan to get home care services, you will be exposed to this. So based on current guidance, we believe this will begin to be implemented January 2022, and the look back will go back to October 1, 2020. So it won't, October 1, 2020 is when they're going to look back to, meaning that until we're 2.5 years away from that, it won't actually in practice be a 2.5 year look back period. So for example, if you apply in January 2022, your look back will only be for 15 months, not 30, because it's only going back to transfers done starting October 1, 2020 forward. So hopefully that makes sense. Eventually it will be just a straight 2.5 year look back, but this beginning date matters until we're 2.5 years away from the implementation date. We do think this might mean that folks who are transferring into a pooled trust, their spend down, will have to make sure they are using their spend down, folks who are 65 and up. One thing to know is that we often get this question, if you use a pooled trust in order to divert your excess income or assets, and then you end up in a nursing home, a pooled trust can only be used to divert your community, for community-based services. So let's say you have $200 excess income, you need home care services, you go to set up a pooled trust. So you're depositing $200 a month in a pooled trust account in order to divert that so it's successfully considered spent down, and you're getting your services. And a couple months later, you end up needing nursing home care and you have a couple $100s in your pooled trust account. You do have to report that to the county, and that money could be considered available to use toward the cost of your nursing home care, because you cannot use a pooled trust if you are trying to get nursing home care. I know this might be a bit confusing. Again, I do have a little bit more information that I'm going to go over, but I just kind of want to note it as we go along, just in case. So managed long-term care plans are the type of Medicaid plan that you would be applying for if you need home care services. From 2014 until July 2020, Medicaid managed long-term care was the type of plan you would apply for, no matter what type of long-term care you needed, if you needed home care or nursing home care. In July 2020, they began to reverse this. So in July 2020, folks who were in a nursing home and on a Medicaid managed long-term care plan started to be disenrolled from their plans and put on just straight fee-for-service Medicaid. And new applicants who apply for nursing home care, it's fee-for-service Medicaid that you're applying for. So there are multiple different types of buckets of Medicaid, I guess you could call it. So fee-for-service Medicaid is just a straight Medicaid program, and that's what's now covering nursing home care. Managed long-term care plans are plans run by private companies that have a network of providers that then contract with nursing agencies to get the services provided to you. So you are bound within a network of services for any services that you need. And they are provided by private health insurance plans such as Fidelis, Kalos, those are some local plans. And they are providing your Medicaid services and coordinating all of your care. So if you need 120 days of skilled care or more in a year, you qualify for an MLTC plan at home. How do you figure that out? Essentially, for first-time enrollees, if you're looking to get some home care services, Medicaid managed long-term care provides 2 different levels of home care services. Level 1 would just be services that are quote-unquote homemaker services. These are assistance with household chores, meal preparation, making the bed, sort of things like that, helping you get ready for your day-to-day. Level 2 is a little bit above and beyond that and can include some skilled tests. If you need help, I kind of like to draw the line where, if you need help physically, if the aid is going to be touching your body to, help you bathe or help you get dressed, help you with toileting, things like that, more physical contact, that's probably the level 2. So you can get anywhere from assistance with households activities of daily living ensures, all the way up to potentially 24/7 nursing care, skilled care at your home through an MLTC, sometimes waiver programs as well. So what you do is apply for Medicaid at your local Department of Social Services, and then you contact a place called New York Medicaid Choice, which is a contracted agency that the state contracts with in order to do what they call a conflict-free assessment. All that simply means is they're going to send a nurse out to your home, or during the pandemic, they've also been done virtually, but they are going back to in-person assessments right now, just to note that. So they send an independent nurse assessor. This is somebody who does not work for any of the MLTC plans directly, to go through your activities of daily living with you and see what level of care you need. This is where they determine, okay, does this person meet the higher standard for care? Do you need 120 days or more of care? If you're somebody who is only looking for grocery shopping and meal preparation a couple hours a week, you might not meet the threshold. So that's what the nursing assessment does. And then when you're approved, you have 60 days to choose a plan, or you will automatically be assigned one. And MLTC plans, once you choose a plan, create a personalized plan of care for you. This is just some important information about appeals. So when there are determinations made with government benefits, you do have the right to challenge those determinations if you disagree with them. So there's an appeal process. Let's say that you are approved for let's say you're approved for 10 hours a week of home care. You really think you need 20 hours a week. So you put in a new request for 20 hours a week instead, and you get denied. You have the right to appeal that decision. You can request an internal plan appeal, and then once you receive a final adverse determination from the plan, if they decide to again deny you after you appeal internally, then you have the right to a state fair hearing. So there are certain timelines for this. There's also something to know about what's called aid continuing. So let's say, annually you get reassessed to make sure that your needs are still being met appropriately. And let's say you're already in this plan and you're getting 24/7 care, but your new assessment says, you know what, you don't need 24/7 care anymore. You only need 8 hours a day. Your circumstances have changed or your health has improved. They have to give you a notice before proposing to reduce your care. And you can request an appeal of that. You must request an appeal within 10 days and specifically ask for aid continuing if you want your care to remain unchanged while your appeal pends. So if you request an appeal, if you forget about it or you let it sit for a few weeks and you request an appeal 15 days later, you still have the right to request that appeal up until your deadline. But, so you have 60 days to make the request, but you only have 10 days to make the request for aid to continue. So that's just really important to know, that you do need to act quickly if you don't want your care. That otherwise the plan does have the right to lower your care to the lower level while everything pends, and then if you win, they have to immediately restore it. This is also true then. So let's say you do the internal appeal and you say, I want aid continuing, and you make it within the 10 days. The plan then comes back and says, here's your final adverse determination. We're holding up our denial or our proposal to reduce your care. You then can request a state fair hearing. You must also request that state fair hearing in 10 days and specifically request aid continuing for your care to remain unchanged. It's a little bit of an abrupt turnaround that you have to pay attention to, because you actually have 120 days to request a state fair hearing, but only 10 days if you want your care to remain unchanged. So I already discussed some of this. So major issues that we see in Western New York. One thing that we try to do at the Center for Elder Law and Justice is consult with people throughout the entire process, no matter where you are, if you're hoping to stay in the community or just generally have questions about your long-term care and how you can pay for it. So, people often ask, when is the right time to call and get a consultation and discuss these things? Really, anytime. We help people all throughout different phases of this process. We speak with married couples who are saying, what if we speak with, adult children who might be power of attorney who say, mom's at a point where she needs nursing home care, what can we do? We speak to people who are already in a nursing home and they say, I'm starting to get billed and I don't know how to pay for it, what do I do? All throughout, there's no wrong time to come and seek counsel about this. And I strongly advise, even if you get the individualized or even if you get the general information, to reach out for individualized consultation, because the budgeting is very complicated and differs person by person depending on what your income and assets are and what your actual medical diagnoses are. What care are you looking to get paid for? What do you need now? What might you need 10 months from now? It's all a very individualized conversation. So, staying in the community is just oftentimes what folks have the goal of doing. Transitioning from rehab or skilled nursing facility back to the community, this is something that we can connect you with resources for and figure out how to get home care set up and things like that. Budgeting, environmental modifications. So something just to note that, let's say you end up falling and breaking a hip and going to the hospital, needing to go to rehab for a little while so that you can get back up on your feet and learn how to walk. And let's say you get to a point where, you really realize that you need some grab bars put up in your home. It's not really safe without that. And maybe you need a roll-in shower. Maybe you need to start sitting down in your shower and it's not safe for you to lift your leg up over your tub to get into your shower. And these are the things you really need in order to go home safely again. But how are you going to pay for that? Well, if you are in a Medicaid managed long-term care plan, then you may be able to get coverage through Medicaid for environmental modifications. The definition to environmental mod is very broad on purpose. It's intended to try to help folks identify what they might need to modify in order to live safely in their home. So the MLTC plans and waiver programs, there are slightly different qualifiers there, but you can make requests for modifications to your home that are medically necessary. And so if you have the documentation to support it, you might be able to get your Medicaid plan to install a roll-in shower and install grab bars in your house and pay a contractor to do those things, depending on what your needs are. We've also seen cases where maybe you need a walker and you're having a really hard time rolling that walker on your carpet. We've had a case where we assisted someone in an appeal and were approved to get the carpet torn out and their floor refinished so that they could more easily walk around their house. So any kind of thing like that, if you need a modification to your home in order to be there safely, give us a call. We might be able to figure out what your plan, what your insurance can cover for that. Staffing issues. So when I say you can get approved for up to 24/7 care in your home, the major caveat to that is that it's difficult to actually access that level of care. Doesn't mean you don't have a right to it. Doesn't mean that we can't appeal and see what we can do to try to help you access that level of care, but there is a staffing shortage across the state of New York, across the country. It has gotten worse in the pandemic. There are a lot of systemic issues of why. The Medicaid payment rates are low. It's a hard job for not a lot of money. There are transportation issues. If you are relying on a bus line to get out there, the more rural that you get, the more difficult that becomes. Maybe the closest bus is still 2 miles from your client's house, and we live in a pretty snowy state. That can make the job not very appealing and pretty difficult to find staff. The counties who have the most trouble are the more rural ones. Let's say Cattaraugus County, for example. You might have to drive a full hour to your client's house, but be in the same county, and that can be difficult. And so there are a lot of issues with staffing. Essentially, there's a staffing shortage across the board, and there are some advocacy things that we can do. And we also do at the Center for Elder Law and Justice have a policy unit that does advocate at the policy level for systemic changes and, better pay. And we want the government to be addressing these concerns so that folks aren't forced into nursing homes. But it's just something to be aware of. You know, oftentimes plans do try to lower the level of care that individuals are getting because they just don't have the staff. And that's not an appropriate reason to lower someone's care if they medically need a certain level. So something to, you know, pay attention to. And all of these things are things that we assist with here at SLJ free of charge. So what is a pooled trust? I know I've talked about it quite a bit. I'm going to go into just very briefly. A pooled trust is a tool that can be used to enhance the quality of life for individuals with disabling conditions. The trust can be used to purchase additional items and services not adequately covered by government benefits. So this means that the trust cannot replace, is not intended to replace Medicaid. It is intended to supplement Medicaid. The pooled trust must be used for the benefit of the individual with the disabling condition, and expenditures have to be made on behalf of that person. So what are the eligibility requirements? The individual must be disabled per Social Security standards and have Medicaid. So if you've ever received Social Security disability in your lifetime, you've been deemed disabled. If you are above 65 and you never received SSD, then there is a separate deeming process that you can go through, not with the Social Security Administration, actually with the New York State Department of Health. It's a very simple process. It just can take a little bit of time. You have to go to your primary care doctor, get them to fill out a form, and you yourself have to fill out a survey about what your needs are. Then documentation is sent in to the State Department of Health and a formal determination is made as to your disability. So it doesn't mean that if you never were deemed disabled or were on SSD or out of work before age 65 that you just aren't going to qualify. It's just a different process. The pooled trust, let me just cover a tiny bit more. So how does it work? If, you know, once you are assessed your Medicaid eligibility and you're found to have a spend down, if you're disabled, you can divert your income. So what that physically looks like is, you know, I can speak to the Western New York Coalition Pooled Trust. Us at the Center for Other Law and Justice, we actually are co-trustees of this local trust along with People Incorporated. So let's say that somebody has a $200 spend down and they use our trust here, the Western New York Coalition Pooled Trust. You get your monthly income for the month, let's say on the 5th of the month. You can then write a check to your trust account for the $200 and send it in, and it can be deposited in your trust account. There's also options for direct deposit and other things, but let's just say you get your Social Security directly deposited into your account, you write a check for $200, your spend down amount to your pooled trust. Then what happens? The money is successfully diverted and has left your hands, so you qualify for Medicaid in that month. You lose direct access to the funds in the trust account, meaning that you don't get a checkbook or a debit card to your trust fund account. But you self-direct and make requests on how you want that money spent. So it's still your money. You can send in your monthly bills. Let's say for $200, you know, you send in your gas and electric bills. What the trust would do then is review that and approve it and issue the money to the third parties directly. So we don't say, okay, your electric bill was $100 this month. Here's $100 to go pay it. We pay National Grid directly the $100. So you can, you know, typically pay for a lot of different monthly bills. If you need clothing items, things like that. You know, there's the sole benefit definition is really, really broad. Let's say you live with a family member and you're renting, or maybe not even paying rent, but you live with a family member and you say, I want to pay for some of the monthly, you know, the household bills. What can I do? Let's say 3 people are living there. Let's say you're living with an adult child and their spouse, and you are residing there as well. We would divide the total monthly bills by 3 and be able to pay 1/3 of the cost of the household bills in that kind of a situation. So there's, you know, individualized circumstances we would go through, and we help folks with their monthly budgeting. But really what it does is it helps people retain access to most of their income and also get the healthcare services that they need. Using a pooled trust has been shown statistically to help individuals remain and age in the community for a longer period of time. On average, there was a study done a few years back now, I think it was maybe 2016 by AARP, and at that time they were saying the average, you know, extension of time was 1.5 years. for elderly folks who are using this scheme. You know, that's a year and a half more of life at home. And for a lot of folks, it's much longer than that. So using a pooled trust is a really beneficial tool to help folks maintain access to the majority of their income, get the services they need without just depleting all of their income and resources on the cost of their care. That's the whole theory, is if you have high needs, you shouldn't be forced to be completely poor to pay for your cost of care. So if anyone, you know, I could do a whole 1 hour presentation on pooled trust alone. If anyone has other questions, please feel free to email or give me a call. And if you have individualized scenarios to talk through, again, give me a call or send me an email. I'm happy to go through things. Does anyone have questions now? I didn't see anything pop up in the chat.
Kelly, there are a couple questions.
Okay.
The first, what kind of household items or expenses can be used to spend down resources?
Okay. Oh, I'm very sorry that some folks couldn't hear me. I didn't see the questions popping up during the chat. So you can spend down, you know, if you are using a pooled trust, it's anything for the individual's sole benefit. If you are not using a pooled trust, the only way to meet the spend down is to either pay it to the county or your MLTC plan directly, whatever the county directs you to do as essentially a premium, or to submit recurring medical bills that you have. Let's say you go to a provider who doesn't take Medicaid. You go to some kind of specialist, a podiatrist or something that doesn't take Medicaid. Or maybe a podiatrist is a bad one. I don't know why you'd be going every single month. But you know, you have something that is medical related. The county has to review and approve those bills, and it does have to be recurring. You do have to show that you're likely to have them recurring for a minimum of 6 months in order for you to be able to meet your spend down requirement with medical bills. If you are disabled and you decide to divert and use a pooled trust, then your options really open up. It's anything for the sole benefit. So household bills are the most common thing that we do, like mortgage, rent, electricity, water, you know, property taxes, things like that. But we can also, you know, let's say you need a new couch and you want to, you know, spend down on that, or clothing items or groceries, unless you're on SSI. If you are on SSI and in the pooled trust, usually, you know, under age 65, then we can't pay for groceries or rent because it's considered in-kind income and you'll lose your SSI benefit. But otherwise, if you're not on SSI, then it's really, really broad, anything for the sole benefit of the individual.
And then we have another, what's the best way to apply for the Medicare savings plan?
So there is an application. It's very short. You can find it online, and you apply directly with the Department of Social Services. So you can you can call the Erie County Department of Social Services and tell them that you'd like to apply, and they'll send you an application as well.
I think our last question so far is, does this information pertain to other states as well?
So each state has separate budgeting. So not necessarily. There are pooled trusts available in other states. There are similar programs in other states, but the way that Medicaid is funded is through the federal government. Every state has to have a Medicaid program, and then states can also opt to be an expansion and provide more services than what's minimally required. New York State is an expansion state, which means that we provide more services than a lot of other states choose to. So, you know, I'm only the expert for New York State. I can't speak to what other states do. The answer is maybe sometimes. Other states do have Medicaid managed long-term care plans and home care services, but a lot of states don't as well. And some states do not allow pooled trusts to be used. So it really does differ. And if you are watching this or taking care of someone in another state, the advice is to reach out to someone in their local county and get consultation directly where they're living.
Okay, thank you, Kelly. That was a very comprehensive presentation. I hope everyone learned a lot and your questions were all answered. If you did have any trouble hearing, this recording will be available in the future on YouTube. I only have the one comment, Kelly, so I'm sure if other folks had trouble or not. Thank you for joining today, and join us next week for our last of the 2021 summer series. Our topics will include the new power of attorney law and what the changes mean for youth and other abuse. Thank you, Kelly. Thank you, everyone.
Thank you.